Welcome, everybody, to our Santa Cruz County Health Workforce Council quarterly convening, hosted by the Health Improvement Partnership with Santa Cruz County. We're excited to have you all join us today. And as people are entering the room, let's go to the next slide, Maria. You can share the slide.
Thank you, Haley. Good morning, everyone, and welcome. For those who don't know me, my name is Maria Cela Jerezano, and I'm a program coordinator with the Health Improvement Partnership. So to get us started, please introduce yourself via the Zoom chat with your name, role, organization, and any workforce projects or goals for 2024.
Great, thank you, Maria. And for those of you just joining, I am seeing a couple new people to the meeting, which is wonderful. So just a recap, my name is Haley Mears. I'm the Senior Program Manager for HIP's Workforce Development Program. And we're excited to have you all here today at our Santa Cruz County Health Workforce Council meeting. We're going to be going over lots of exciting updates today. We will have a presenter on our healthcare labor market information for our region and also specifically Santa Cruz County. We have one of our work group facilitators going to share a summary of all the work that work group's been doing for the last year in our primary care and pediatrician workforce efforts. And then we have a guest presenter from UC San Francisco who will be sharing with us about the nurse practitioner program that they have there. And then we'll, as always, provide some Workforce Council updates on all the work that our work groups have been doing and a closing with some of the really exciting updates about our meetings that are coming up this year. So with that, we're going to jump right into our agenda. So next slide, please. I'd like to introduce to everybody Jack Michael. He's with the Bay Area Community College Consortium, and he's going to be sharing some updates on all the labor market information we've most recently received. And I know you probably have more of an introduction, Jack, that you might want to share. So with that, I'll turn it over to you.
All right, my name is Jack Michael. I am our K-14 Pathway Coordinator for the Santa Cruz Cabrillo Community College District. And what that means is I help institutions align their career education / CTE, career technical education pathways so that they run as smoothly as possible from high school through community college or trade school or whatever kind of training they need to get into these careers. So career education generally means careers that pay a livable wage and hopefully even more than that are in demand, that require less than a bachelor's degree. They could eventually, someone could move on to a bachelor's degree, but getting folks who are in underrepresented situations, single mother-led households, students of color, underrepresented folks into these positions so that they can, because a lot of these underrepresented communities, as you all know, as we all know, don't necessarily have the time to be in school for bachelor's degree and then master's degree and all those kind of things. So those are generally the things that I work on, but also not limiting folks. So it's not pigeonholing folks into a career or certificate pathway where then they'd have to start all over again if they wanted to continue in their field. So that's what I do. And I work with all of the K-12 districts as well as Cabrillo Community College and the County Office of Education and industry partners. So that's what I do. We can go to the next slide. Maria, I think you're at the controls. All right, before we get started on our data, these are some numbers just to keep in mind when we look at some of the different health career pathways and how much they pay. This is from a presentation that was put on. It was the Real Cost Measure event put on by the United Way in Santa Cruz County. And it talked about the actual cost of living. So supposedly, at least according to the Center of Excellence for Labor Market Information, they say that the cost of living in Santa Cruz County is $24 an hour. But when we break it down and look at, okay, what's the actual cost of living? And the presentation is linked there, and I'm sure you're going to get this. You can take a look at that. But the actual cost of living more comes down to about $28.28 per person. So a little over $28 an hour per person. And yes, this gets into a household of 2 adults, 1 preschooler and 1 school-age child, and then how much that household would need to make annually and then per hour. And then one of the things to think about too, with some of the folks who we're hoping to recruit into these positions in healthcare where we need people, is if any positions that people are in pay less than $28 an hour, in order to make that $177,000 and $664 annually, a lot of time to subsidize that income if folks are making less than $28 an hour in their job. The high school age children are working and paying towards the household income, and sometimes folks are working additional jobs. So that's just something to keep in mind as we look about retaining folks and getting folks in these positions we need. All right, we can go to the next slide. All right, so some of the positions, most of the slides are going to look like this. If I had some more graphics and things, and if I was willing to sacrifice some of the cells and columns from the spreadsheet I pulled this from, this would be much more interesting and interactive. But we really wanted folks to see the real breakdown per county for these different positions. And what we did is we took a region-wide look and we extended it into Santa Clara County, as you'll see, for each one of these positions. Because as you all know, we have a lot of folks from our county who are working over the hill. And then we have folks just working regionally, and that also includes Silicon Valley, not just the Monterey Bay area. So taking a look at these and what some of these positions pay, another thing to keep in mind is how much debt some of these potential workers might be carrying. So we see that, for example, the SUD and mental health counselor, the average is $28.60 per hour. Something else to keep in mind, though, is, that's being cut into if folks are dealing with school debt. And one of the issues that Haley and it was brought to my attention from Haley, and then we've been working together on it since then, is some of the programs to train folks, if it's not a community college option for that particular pathway, there are for-profit options. So for example, the surgical tech position, the closest community college option is Skyline College, which is all the way up in the peninsula. And a closer option is Carrington College in San Jose, which I'm sure could be fine. I'm sure everyone there is nice, but that's a $45,000 plus program for tuition for folks to do. And when we get to that particular position, you'll see what the wage is. So that's a relatively low wage for how much folks are investing in order to do the program. So sudden mental health counselors average in our general area, $28.60 an hour. But if we look at Santa Cruz, and again, all of the information that we got, and there's a link in one of the first slides where my name and introduction is. This comes from the Center of Excellence for Labor Market Data. And there's a link there if you want to check more out about them and that kind of thing. And we hope that most of that information is up to date. Some of it changes, we all know that, but this at least gives us a rough idea. So there's a pretty big disparity if we look between Santa Cruz and even Monterey County of what SUD and mental health counselors make. Clinical and counseling psychologists, moving down to the next one, those folks are making more. But as we look, going back to the SUD and mental health counselors, there's a huge need. So there is a 6.2% growth per year percentage for SUD and mental health counselors. But if we look at what they're making, it's also very low. So, and you all know this, it's this issue of needing folks in these positions, but how much are they making? And we deal with this with early childhood education. I think the disparity is even lower for what people make compared to the cost of living. All right, school psychologists, they're making more. All right, we can go to the next one. Maria, jump in with any questions while we're doing this. You're gonna get these slides. You'll get to see this, but jump in with any questions as we roll through this, because I do want to honor everyone's time. Mental health, substance abuse, social workers. Again, unfortunately, Santa Cruz County is making the least. And Monterey is making more, but there are also, there's a decent growth per year average, and that's getting a little bit better. And then the average comes out to $43 an hour for our general area. But if you see how much more folks are making in Santa Clara, as I'm sure you're used to in your health facilities, we're losing people who live here to higher wages over the hill. All right. And we can go to the next one, Maria. Thank you. All right. And community health workers. And I think Adrian Saxon is here. I mean, what an amazing and needed position, right? I mean, hardworking folks connecting with our communities, just very much in need. And unfortunately, the median hourly earnings, and if you know any differently, Adrian, please jump in for Santa Cruz County. But in Santa Cruz and Monterey, the earnings are pretty low, unfortunately, which is a crime for such an important position. Because there is a budget crunch for the state, as I'm sure you all know about, and there is a budget crunch for our community colleges, programs that do not have enough enrollment could get contracted or reduced. So that's something to keep in mind too, in terms of promoting for these programs. We do have a community health worker program at Cabrillo, which is totally awesome. And in order for that, one of the ways for that program to continue and thrive as it has been is to get enough students. So that's another piece of this with community health workers. And again, unfortunately, the wages are relatively low, but the work is so important to get services to people who need it and who maybe aren't getting contacted outside of community health workers. All right, we can go to, and Adrian, jump in if you have anything else on that, but go ahead to the next one, Maria, please. All right, medical assistants. Again, this is a relatively low paid position, but as you all know, it's very much needed. There is a program at Cabrillo, and there is an adult program also with the Santa Cruz County Office of Education. And I believe in WASI also, the adult program at run by PVUSD. And those are some of the wages. And we have a decent amount of growth in Santa Cruz County, also in San Benito County for folks who live here who might be going over there. So yeah, so that's what we have for medical assistants. Okay, we can go to the next one, Maria. And registered nurses. And one of the biggest issues, as we all know, with registered nurses is having enough instructors who are able and willing, but oftentimes I think it's more able to take the time away from working and being paid as a registered nurse in order to teach. Again, so there's a lot of need there's a lot of positions in Santa Clara County, and the pay is very good up there. And it also is, according to the Center of Excellence, the pay is the best in Santa Cruz County. So I don't know, and any of you, please jump in if you're seeing discrepancies in this, but this is what we came to with the labor data. All right, we can go to the next one. All right, licensed vocational nurses. You'll see we have a lot of growth. We have a lot of positions in Santa Cruz County, which is great. And obviously the most are up in Santa Clara County. And there is a lot of growth in San Benito County. The greatest rate of growth is there, but the overall positions are obviously a lot less up there. And our pay is a little bit less than Monterey. It's about right on par with San Benito, and it's significantly less than Santa Clara County. All right, we can move on to the next one. All right, and surgical technologists. So this is the one like we talked about. This is one area of need where we have, folks do make above a livable wage, above that $28.28 per hour. However, the biggest rub with this one is proximity to an affordable program. The closest community college option, again, is Skyline College. And the other one is Carrington, which is in San Jose, so that's closer. But like we said before, Carrington cost about $45,000 plus to complete the program. And so then that's a lot of money for a program where the wages are, pretty good compared to some of the others. But after spending with loans of 45,000 plus, that's really cutting into folks' livable wage with that. And just transportation and all the stuff to complete that program. All right, next one, please. And physicians. So I understand we have a shortage, but they're obviously making a lot more. And that's the data we have for various physicians, general medicine, pediatricians. So if you want to take a look at this and jump in with any other questions about those. So this is it. This is what I've got. We put together this data for you so you could see it, and you'll have this. It breaks it down by county, and then the average for our region, which includes Silicon Valley. And so maybe before my time is up, jump in with any discrepancies, any questions, anything that wasn't clear about this data. But this is for your reference. And that includes you, Haley, if you want to jump in or anything you wanted highlighted for folks.
Thank you. Yeah, as Jack mentioned, feel free to ask any questions. You can also drop questions in the chat as they come to you. The main goal for us sharing this is that part of our charter for the Health Workforce Council is to be sure that we're informed and making decisions based on the data that we receive. And so we try to review the labor market information specifically for these 6 healthcare workforce tracks that we're focused on to make sure that we're up to date and have access to this type of data. So thank you so much, Jack, for compiling all of this and sharing it with us. I don't know if you want to share the link to your your lovely Google document that you've created, or we have dropped the link to the Center of Excellence in the chat. So we'll share that with everybody as well when we do our email follow-up. You'll all get the presentation slides and the recording to this meeting.
Yeah.
Yeah.
I think the best thing to do, Haley, is to reach out to me, because the spreadsheet that I work from is a working spreadsheet, and I cater it and pull out pieces of it and build on it based on what folks ask me. So just by itself right now, it's a little bit higgledy-piggledy. So I don't necessarily want to toss
So
that out.
yeah, that would be great if you drop your email in the chat.
Yes.
And anyone who would like to connect further with you on labor market information can reach out to you. And Jack's been attending many of our work groups, so many of you may have seen him. He pops in at almost all of them, and has been an excellent partner and resource for us. So we're excited to have you joining us. I think it's just been in the last half of end of the year of 2023, and now I guess we're already in March, so it's been almost like 6 months you've been
I started
collaborating
in September.
with us.
Yeah, I
Time
started
flew by
September
fast.
1st. And then something to keep in mind, reach out to me, please, because I really do work for you. I work for all of the districts, the County Office of Education, Cabrillo, and industry partners. So please reach out to me, because that's what I'm supposed to do, that's what I'm paid to do, and that's what I like to do. And if I don't have an answer for you or a connection, I try to find it. So.
Absolutely. Thank you. Well, while we're on this slide, I think this is a great slide to kind of introduce our next speaker, which is Dr. Cal Gordon. He is going to provide some updates on the work group that's been convening for about a year now under the umbrella of HIP's Pediatric Health Work Group. Once a month, we take time and meet to discuss specifically the primary care and pediatrician workforce. And those conversations have all been facilitated by Dr. Gordon, who we so appreciate doing that. And so on that note, I will hand it over to you, Cal.
Thanks, Haley. If we can move to the next slide. So in terms of background, I am a pediatrician. I had close to 40 years as a practicing pediatrician, both inpatient, outpatient, as well as a physician leader. I'm also deputy health officer with the county. And a little bit of background for the pediatric work group. It's pediatricians representing basically all of our major pediatric service lines in the county, but also public health and also the County Office of Education representatives along with HIP. So it started addressing the COVID issues when the pandemic came upon us, but it has really branched out now to other areas of pediatric interests and concerns. In our first year, we set about three major goals, and one of the goals was to document the shortage of pediatricians, family medicine physicians, pediatric and family medicine nurse practitioners in our county. And the background of this, I think Jack sort of touched on it. There historically, for the past probably decade, there's been a shortage of pediatric and family medicine residency graduates. And so Santa Cruz County is competing with all nationally and with all the local counties and surrounding counties for the same candidate pool of new graduates from the residency programs. And the challenges is one, salary, and then the high cost of living in our county. And our experience is that people who are attracted to Santa Cruz County oftentimes have either come out of our area or have some sort of experience or connection to our county that attracts them to come our way. And we touched on Jack touched on the salary that the pediatricians and internal medicine doctors earn a comfortable salary compared to the, perhaps some of the other professional counterparts in our county. I would say, though, those specialties are the least paid in terms of salaries if you compare them to all the other sort of medical physician specialists. And also with the context that with college and with medical school, it's not uncommon to have loans up to $200,000 to $300,000 or more. And so paying all of that off in context of that salary has to be factored in. And also just the extreme housing prices that we have in our county. So that's our challenge. We'll move to the next slide. Another goal was really to understand what has already been in place, because we have a number of bright spots where we're really creating a pipeline in many respects. One is the UC Santa Cruz has a number of programs that encourage the students to get into medical school, and we provide there's a number of settings for clinical experiences for medical students or pre-med students to be able to help improve their curriculum vitae for applications, and there's a number of programs to allow them to be successful. And I will say that a large portion of the people going to UC Santa Cruz come from our Central Coast County areas and represent individuals coming from disadvantaged situations, and really is the opportunity for them to have an entree into potentially a high-paying job and also provide services to people in their own community. And so we also have Game Changers, the Morehouse Dignity Family Medicine Program. We never had a residency program in our county prior to this. And so this is a game changer, I think, for us. But we also will be hearing from UC San Francisco, nurse practitioner program, and where there have historically been students out of UCSF who come and rotate out of our counties and then oftentimes will come back to our county to provide services. We will be hearing from Stanford Physician Assistant Program, hopefully in the near future also in terms of learning how we can continue that relationship. We'll move to the next slide. Also, we wanted to address how do we create an integrated pipeline strategy. So taking all the kind of efforts that have been in place and have been successful, but filling the gaps and seeing how we can create a more sustainable, consistent process. And so part of this is really engaging with our schools and on two levels. One is creating a motivation and interest in and knowledge of what's available in terms of healthcare careers, but also working with the schools to make sure that students are prepared effectively so that they can be successful in those careers. And one highlight was the Health Career Expo. I think we have a slide on that the next time. On the next slide, but we also have we've had health fairs at the high schools. We're looking at extending that, perhaps having the equivalence of a healthcare camp in the South County area for individuals, and really we've worked with our Santa Cruz County Office of Education. They currently have an online process that explains how to get into educational careers. And there is an ongoing effort to have a similar process where students can go online, see how much they can earn in a particular specialty area, whether it's a medical assistant, surgical tech, physician assistant, whatever, and understand how to get to that particular profession career-wise. We'll move to the next slide. And this just highlights one of the events that we had on November 4th, where we had 135 students from 7 high schools attend an event at Cabrillo College. So it was in partnership, Health Improvement Partnership, in partnership with Your Future is Our Business and Cabrillo College were able to put on this particular expo. And I don't know if Maria or Haley would like to add more, but I know that it was well attended, and we had a number of employer healthcare delivery systems attend there to tell their story and what they had to offer. So I don't know if Haley or
Yeah,
would like
I'll
to
add. So one of the things we heard back when we did our listening tour in 2022 across all of the healthcare organizations that we interviewed was expressed a desire to do earlier youth outreach around healthcare careers. And so, as Cal mentioned, with Cabrillo College, an organization called Your Future is Our Business, who does high school career exploration events, and HIP as bringing in the healthcare organizations, this was our first ever time hosting this Health Career Expo. I love these pictures because you get to see like students interacting with healthcare organizations. There's the radiology program is featured up there. And then students actually also got to do tours of Cabrillo College's allied health facilities, which was really insightful. And so this event was a huge success, I would say, for our first time ever. We had about 135 students from high school across Santa Cruz County that were bussed in and brought to the campus. And we had about 25 different healthcare employers. We hope that this event will be hosted annually. And so we encourage more employers to join us next time around. And then also just circling back to the health fairs. So we have a few folks from our primary care pediatrician work group working on coordinating, in addition to health screenings that are going to be done at 2 different high schools this May, they've taken kind of the model of this Health Career Expo and want to invite more healthcare organizations to attend the health screenings in a fair type style, so that the students who are coming in for those like sports screenings get the opportunity to learn more about different health careers. And if anyone is interested in attending those events, they're happening soon. They're happening this May at Watsonville and Harbor High. I'll drop my email in the chat. If you're interested in participating, please email me, and then I can connect you to the people coordinating that event as well. But that all kind of came out of the conversations we've been having in this work group that Dr. Gordon is facilitating. So I'll stop there.
Thank you, Haley. We can move to the next slide. And I think this is my last slide. And so going into year 2 with the pediatric work group, I'm going to go in reverse or counterclockwise order to address some of the areas we're going to focus on. One is around mentoring and internships. So one of the things in terms of for fostering student interest and ability to kind of see and really become enamored with a particular work is having the opportunity to have a clinical immersion experience where they can actually be with practicing clinicians to of like kind to see how this might work for them, and they, to really understand what this means, and also get much more understanding as to what's required to get there. And so we're going to be focusing on that, making sure that we can work with this, and a lot of our participants in the Health Improvement Partnership pediatric work group are sort of frontline physicians, and it's really reaching out to the leadership of their organizations and making sure that there's support for this type of activity. And there is an HR piece to you know, in terms of onboarding and making sure that people can be in those clinical environments. And so having sort of an easier process for this to occur, I think it will be really important, because we view this as one of the things that has to be in place for us to have an effective pipeline. I'd mentioned that Dignity Health and Morehouse School of Medicine Family Medicine Residency Program, the first time ever that we've had a residency program actually housed in our county. I think this is going to be a game changer in that it will set us up in so many different ways as a community to be able to work effectively in terms of getting primary care physicians our way, and having a continued pipeline. It's not unusual, it's most common that at least half of the people coming out of the residency program stay in the area that they trained at. And so I think that this is very, very important for us. The other thing I think is pretty profound is that probably at least 15 separate entities participated in supporting the family medicine residency program. So everybody in the community really stepped forward to embrace this, and I think that it will continue kind of unify our approach towards supporting our development pipeline process. The healthcare workforce housing issue is really a major issue. Even on a pediatrician salary, it is hard to find a home and buy a home, and you know, you figure after 10 years of higher education that you still can't afford a house. You know, you can go elsewhere and potentially buy one, whereas you may be potentially renting in Santa Cruz County for years to come, even if you can afford to rent the house. Finding one is another challenge. The recruitment and retention is a major issue, and so we're trying to identify best practices. How do we do this? Can there be some incentives? How do we create pipelines and tell our story more effectively, so people understand really the intrinsic value of working in Santa Cruz County. And the last area is one that just sort of came to fruition in the past several months, although it has been sort of in development for the past year or so. And this is the Central Coast Kindergarten through University Regional Collaboration. And it involves 6 counties. For the North partners, Monterey County, San Benito, and Santa Cruz. And for the southern Central Coast counties, San Luis Obispo, Santa Barbara, and Ventura. And the initiative is a grant, and it is focusing on students out of the Central Coast region that have been historically marginalized to provide opportunities for upward mobility. And the counties had the opportunity to choose between health and the STEM sciences, computer sciences. And for the North County counties of Monterey, Santa Cruz, and San Benito, we chose the health career track. And so there's been $18 million grant for the 6 counties that get dispersed over a 3-year period of time. But and there is sort of a backbone support structure for this initiative. And the major backbone area actually is coming out of UC Santa Cruz, Cabrillo College, County Office of Education, as 3 major entities out of 4 in terms of supporting this initiative. And so we really have the opportunity to align ourselves in terms of the Health Improvement Partnership program around this whole health development program, and this effort really supporting this sort of student initiative, because the values, I believe, and the goals are very, very similar. And so if we can see how we can align ourselves and work in collaboration, there's the opportunity, I believe, for us to be successful for both initiatives. So I'll stop there now, and I will say that I have the pleasure of introducing our next speaker, who is Carrie Evans, who has presented to our primary care workforce development work group. And Carrie Evans is a family nurse practitioner, as well as assistant professor at UC San Francisco School of Nursing. And I believe that it will be great for you to hear what she has to tell about her program. Thank you.
Thanks, Cal, for that introduction, and good to see you again. Enjoying your spring background on your Zoom. So my name is Carrie Evans. I am a family nurse practitioner, and I am also a professor at UCSF, specifically within the family nurse practitioner program within the School of Nursing. So happy to speak with you today. I know we have a pretty broad audience today based on the introduction, so just wanted to kind of share initially what the role of a family nurse practitioner as well as advanced practice nurse, because that might be a term that not everybody is familiar with, and there's a lot of different terms that get shared. So there's advanced practice nurse can also be used interchangeable with nurse practitioners. We also have clinical nurse specialists, but essentially individuals who are in those roles have received additional graduate training, both didactically and in clinical settings, to prepare them to work as a healthcare provider. Most advanced practice nurses work in consultation with a medical doctor, but in the state of California, as of 2023, they can practice independently in providing healthcare. So maybe that just helps people get oriented to what a nurse practitioner does. The program that I am specifically with is the Family Nurse Practitioner Program. I'll talk a little bit more about what our area of focus is as we go to the next slide. Thank you. So the Family Nurse Practitioner Program at UCSF, we are the largest program in the School of Nursing at UCSF. We have approximately 30 students per year in our program. Our program has historically been a 2-year master's program. So this is for individuals who've either completed an undergraduate or some form of training as a registered nurse, and then go on to get complete graduate work to get a master's program. So we are actually moving from a master's program, which has been a 2-year program. Our last cohort of graduates in the FNP program are going to be graduating next June in 2025. And starting this year, we're going to be enrolling students into a 3-year program. So we're moving from a master's program to a doctorate of nursing practice program. What that means is that students are going to now be enrolled for a 3-year program rather than a 2-year program. We will then, based on that timing, anticipate graduates coming out in the year of 2027 from our programs. Those who are trained in family nurse practitioner programs work in a broad range of clinical settings once they complete their training. So we have individuals who work in community clinics as well as private practice. They may work in hospital settings. They also work in academic institutions and school-based clinics, as well as tied to public health departments. So a variety of different settings. Some individuals go into specialty clinic settings. With the family nurse practitioner program and our focus, it's usually mostly outpatient settings for that, although a fair number are interested and have gone into urgent care. Next slide, please. So some of the areas of the focus of the training for a family nurse practitioner program, we are focused on primary care. So the training and the goal in the training is to support our students into graduating and going out into primary care settings. And currently, I collected some data recently in surveying our graduates. And in the last 3 years, we've had 73% of our graduates go into primary care settings. I know that was a question at the pediatric primary work group, so I wanted to share that. So the majority of our graduates are going into primary care settings. We also have a strong focus on training individuals to provide care in underserved patient populations. That's always been a strong focus of the UCSF Family Nurse Practitioner program. We have really want to be addressing social determinants of health, where there's, working with patient populations that have had disparities in care and outcomes. And so really trying to target those patient populations as well as settings where there's those high needs. A couple of examples of how, in addition to just what's embedded in all of our coursework, we recently started a new scholarship program for students in our program called the Underserved Coalition for Bay Area Advanced Practice Training. And that's for students in our program to be able to participate in this scholarship program, which gives them additional funds as well as additional support and mentoring to work in high need patient settings. And then we also have a rural health concentration. This is not specific to the family nurse practitioner program, but broadly across all of the School of Nursing. But that's also been another area that I think is relevant to this group, which is that we have for students who are interested in diving more deeply into providing care in rural health settings, and that's actually a pretty broad term that we use. They can get additional elective coursework and placements specifically in sites that qualify as rural health. And based on my understanding of most of the sites in your region, that would be that the region would fit that criteria. One thing that's also special to the family nurse practitioner program, the training is that individuals who come out as a family nurse practitioner can work with patients across the entire lifespan. So that's everything from birth to death. We have, as part of our training, students get trained in pediatrics, working with adolescents, adults, and geriatric populations. And then another core focus of our program is that we advocate for and empower individuals. So it's a very strong focus on patient-centered care and also thinking holistically about how their care is taken into consideration within the scope of their family and the family dynamics. Next slide. So I wanted to share a little bit more about the clinical training that the students get. And that's, we have recently had some more students doing placements in the Santa Cruz region, and that's been really valuable because one of the strongest predictors for where people choose employment after graduating does tend to correlate with where they do placements. So the clinical residency training that occurs within our program, our current minimum requirement is 650 hours of completion. With that said, we encourage students to try to do as many additional hours as is feasible, and that we can match them with, given our availability of preceptors and sites. But we do like to give them as much training as possible. So we do have students complete a fair number of students will complete upwards of 1,000 hours. We will actually, as we move to the doctorate of nursing practice, be requiring a minimum of 750 hours training. Within our training at clinical sites, areas of focus include a requirement within the family nurse practitioner program to complete primary care. That's the biggest component of our training that we require of our students. It's a minimum of nearly 50% of their training should be within primary care. As well as pediatrics, we do require students to complete a minimum requirement around training in the pediatric area, and then also in sexual and reproductive health, which includes women's health. Students also complete training in different specialties, and that can often have to do with if they have additional interests. So just giving some examples, you know, orthopedics, diabetes, oncology, we kind of, you name it, we match students at rotations in different specialties based on availability and what their interests are. And students, their placements and their clinical residency training begins towards the end of their first year. So after they've already had a chance to have a strong foundation in their didactic coursework, that's going to help them launch into being in clinical settings. Within clinical residency programs, in addition to nurse practitioners serving as teachers and preceptors, we can also have physicians and physician assistants also provide that training. Next slide, please. So this was last slide I just put together with some ideas that came out of our last meeting in the pediatric work group of how UCSF, the FNP program, and the Santa Cruz Health Workforce can work together. So some of these things have actually come up already in the earlier presentations with Jack and Cal. But just to reiterate, you know, one thing that can be really valuable is helping provide pipeline activities and opportunities for those who are in high school or earlier in their lives and thinking about career choice, so that they understand what it means to be an advanced practice nurse and nurse practitioners. We actually require our students as part of the program to complete at least one pipeline activity to go out there in the community and speak to individuals about their field, and in particular, trying to increase the interest in groups who have been underrepresented in the advanced practice nursing population. So that is something that we can definitely continue to work on and build more with interest in helping to, you know, get our students to pipeline activities in your area. Then also to you know, having opportunities to outreach in the Santa Cruz area for prospective students to the DNP program. As Cal mentioned, that one of the kind of valuable things that's been, if somebody comes from the region, goes to school to get their training, and then comes back to the area to practice. So we do have a new director of recruitment and outreach that I'm happy to, you know, connect you with if you want to have them sharing, in particular, as we've made this change to a doctorate of nursing practice, what that means, and to be able to share what our program does, which could be helpful. Another area is clinical placements. So as I mentioned, one of the strongest indicators for individuals who graduate from the program and where they end up working is if they've done training during their program at that site. That develops really strong relationships and often ends up being like a, of real benefit to the the institution that has invested in that training, as well as for the graduate who is now already had some exposure in that setting and can kind of more fluidly move into their first role after school. So we currently have some clinical placements at Palo Alto Medical Foundation, as well as Santa Cruz Community Health. And just want to say how appreciative we are of the preceptors, the healthcare providers, and who've been willing to precept, because we know that that's something that they're doing in addition to all of their work, as Jack mentioned, on top of all their paid responsibilities. This is something they're doing because of their commitment to teaching and their desire to invest in the future training, future job force. And then lastly, just sharing that, certainly different ways to support employment recruitment as students graduate from the UCSF FNP graduate from the program. So, a couple things that come to mind. We do have a job fair we're organizing that's planned for this May. So if there is interest in participating in that, I can connect you with the folks who are organizing that. We also share all sorts of job listings and postings with, our students as well as alum through social media channels. And then one insight I've gleaned from seeing students graduate and go out, what they're really looking for in one of their first job, in particular, in one of their first jobs out of school, is sites that are going to provide support for a new graduate, and that can come in a number of different manifestations, everything from, being able to modify, their patient load and building up, as well as, who might be mentoring them in those early days. We've had some institutions start doing new graduate programs specifically, where they work with new graduate cohorts. And we've also seen a lot of success with residency programs for recent grads. So that is all I have to share today. And thank you for letting me come speak, and happy to answer any questions people might have.
Thank you, Carrie. We have some time. If there's any questions for any of our three presenters, Jack, Dr. Gordon, or Carrie, we'll pause here if anybody wants to unmute or drop a question in the chat. Feel free to do that. And if you could move forward the slide, I think you went back, Maria. Yeah. So I'm not seeing any hands raised, but
sorry, I actually do. Did
okay.
I miss it? Is there a midwifery component at all to the nurse practitioner? Sorry, did I miss it? I apologize.
At UCSF?
Uh-huh.
We do have a midwifery program, yes.
Thank you.
And I'd be happy to put you in contact more directly if that would be helpful.
Yeah, and I think, Carrie, if you're willing to share your contact information in the chat, your email, that'd be great too, so people can connect with you directly. There's a question about where will the job fair be held? If you're referring to the health screening career fair, those will be at Watsonville and Harbor High Schools. I'm not sure if that's what the question is in reference.
I think Carrie mentioned one as well. That was a different one, yes?
Yes, so that would be for, the plan is to have a job fair for students who are in some of our nurse practitioner programs and graduating this year. It would be at the UCSF campus. I don't know if we've identified the exact location, but you can reach out to me and I'll connect you with the folks organizing.
Okay, thank you.
Great. Any final questions for Carrie, Jack, or Dr. Gordon? And if something comes up, feel free to drop it in the chat as well. Okay, well, we're going to move on to the last section of our meeting today, which is our Health Workforce Council Workgroup updates. This is a photo from earlier this month, myself on the far right and Maria. We were able to present at the California Primary Care Association's Workforce Symposium, basically all of the accomplishments that this council has been achieving over the last year and a half. We co-presented with the Alameda Health Consortium, who is also doing a workforce project, and they're a little earlier in their process. So it was very engaging and inspiring. We had a really robust discussion at our session. And we also got the opportunity to, work together in person. Maria and I both work remotely, as many of you know. And we also were able to connect with some of our Santa Cruz partners like Janus of Santa Cruz and Santa Cruz Community Health Center. So I'll share a little bit more about that at the end of our presentation. It's, I think, exciting for us to share with you all that when we bring this work statewide, people are really excited about what we're doing and want to replicate our model of the council. And so having you all contribute to the work and continue to show up and be present in our work groups and at this council is so important. And it's just really exciting to see other regions be excited about the work we're doing. So with that, we can jump to the next slide. And I want to share, so in most of our most of our council meetings, we share updates on all of our work groups, but there's a couple areas that our workforce development is trying to support and has supported since the listening tour that we don't always feature because we don't have a regular convening. But I am really excited to share Santa Cruz County Office of Education was awarded in conjunction with a partnership with Dientes Community Dental Care, the California Apprenticeship Initiative. They were awarded a planning grant and they just now received the second step of that grant, which is the implementation grant. And so what this means is they're going to be launching a nine-month program starting in September of this year. They will be having 8 apprentices working at Dientes Community Dental Care, and those wages will be subsidized with Santa Cruz County Workforce Development Board for these registered apprenticeships. So this is like a conversation that Laura Marcus and I had in early 2022, and so it's really exciting to see that we identified a challenge and a solution came out of the work that we've all been doing around health workforce in Santa Cruz County. So this is just, I want to just celebrate this success story. Unfortunately, I don't think Laura or the dental assisting program is on this call today, but we'll be sure that we reach out and share our celebratory celebration with them in many different ways. So we can go to the next slide. Another area that Jack mentioned a little bit earlier, this is an area where, again, we don't have a regular work group convening, but we have been working behind the scenes on thinking about how we could bring a surgical technician, technologist program or a pipeline to Santa Cruz County. And so working with the Bay Area Community College team, including Jack, we're really discussing what kind of strategies we could use to fill the gap. And some of the ideas would be having one of our community colleges in the Monterey Bay region host a cohort or doing a rotating cohort, or maybe utilizing Skyline Community College and having some type of extension program in Santa Cruz County. So we're really exploring a lot of different options here. And we're really excited that this month, we will also be meeting with Sutter Surgery and Dominican to learn more about what their needs are and discuss these options with them. I think we actually have maybe a few people on the meeting today. So Alexis, thanks for being here. And I think Leilani is here too. So just we're really excited about seeing what could develop as we continue these conversations. And this doesn't always get featured in our regular convenings, but we are working on this kind of behind the scenes and wanted to give you that update. As Jack mentioned earlier, we don't have an existing surgical technologist program here in Santa Cruz County or in the entire Monterey Bay region. So we're hopeful that something will be implemented and established before we complete, the end of our grant work. So happy to provide more updates on this as we learn more about what our options are. Next slide, please. So this is a little recap from a little bit of work that each of our work groups have been doing. For those who may not be familiar, our work groups convene on a monthly basis. All of these meetings are held virtually. They're very inclusive. So if anybody wants to join one of these work groups, please just let us know. And Maria can drop her email in the chat, and she's the person to reach out to as she'll send all the calendar invites. So our Integrated Behavioral Health Action Coalition, we meet monthly to discuss workforce, and then we host a convening in March, and we'll host one in June. That's a larger convening, the IPAC quarterly convening. So we just had that yesterday. It was a really engaging convening focused on youth mental health. We had co-presenters from Santa Cruz County Office of Education, the Alliance, the Calciano Symposium that was just recently held. Was that takeaways from that and discussion were brought to this meeting. And so we do have that meeting recorded, and if anyone's interested, wasn't able to attend yesterday and would like to watch the recording, we can share that with you. And then where our workforce efforts are focused will be having a discussion at our next meeting around what could we do to develop clinical supervision best practices and some law and ethics trainings, and whether that might also be offering CEUs, or we're just going to explore all our options around that for our county. And so those meetings centered around workforce are facilitated by Jasmine Najira, who's the CEO with Pajaro Valley Prevention, Student Assistant Prevention. And so she's not here right now today to share updates, but we really appreciate the work that she's been doing with us to move forward our workforce projects under the Integrated Behavioral Health Action Coalition. I'm going to move over to the Monterey Bay Community Health Worker Collaborative. And Adrian, since you're here with us, would you like to share updates?
Hi, everyone. Yeah, sure. We have been working hard, and one of the updates we have is that Cabrillo College was awarded an apprenticeship grant for community health workers, and we're really excited that People First is our first employer that has jumped on board. And of course, we're continuing to work with our partners to identify more employers that would like to utilize this wonderful opportunity to, earn to learn programming, supporting, folks with actual employment while completing the CHW certificate. If you want more information, feel free to email me and I will get you connected. Another thing we have been continuing to work on is being involved with the California Health and Human Services HCI Medi-Cal CHW certification requirements. They're hosting listening or dialogue sessions right now, and we've really requested to be one of those dialogue spaces, but have not yet heard back. In any case, hopefully more to come on that soon. We have had two community health leader, we've had multiple community health leader convenings through the ACEs Aware project. The last one we did actually was really wonderful because the county, Santa Cruz County, was asking for feedback from our community health workers regarding the maternal health data and priorities. And so the next convening that the county is having with our community health workers is focused on youth health. So we're really excited about the collaboration that we're able to have with the county office. And then, of course, just continuing to be involved with the Your Future is Our Business engagement, and really trying to get the word out about this profession. And Jack, that's really my only feedback about, you were mentioning the pay, is that really this profession, though it's been around for the ages, it hasn't been acknowledged in the state until COVID. And so, yeah, the return on investment is still being kind of figured out here, right? And so I do know that the Clínica de Salud was offering a position for a trilingual speaker, one in Mestico, for $35 an hour for a CHW position. So there are high paid positions, but you really do have to have that multilingual capacity. And $35 an hour is the highest I've seen for our region. But in any case, that's a little feedback on that. And thank you very much, everyone. That's it for us. Unless I've missed something, Haley, you probably have something to share.
Well, just to note that our next meeting in April, we have one next week. If anyone wants to join us, we meet the last Thursday of the month from 2 to 3. So again, Maria will put her email in the chat, and you can email her. She'll send you the calendar invite. And then the April meeting will be Cabrillo College's advisory committee meeting for that community health worker program. Do you want to quickly explain, Adrian, why those are important for the advisory committee meetings?
Correct. Yeah, this one's going to be really important. We're facing budget cuts and actually a lack of support. And so really having our employer voices regarding the value of the certificate program is going to be really, really important to us being able to continue to deliver the CHW curriculum through Cabrillo College. That's, I guess, my biggest thing is that's where employers provide feedback to Cabrillo College. Sure, regarding curriculum outcomes, the connection that we have through internships and now apprenticeships, but also really to demonstrate that support for the certificate program is critical in that space.
Absolutely. So if you can only dedicate 1 hour of your time to this community health worker effort, come to the April meeting and show your support. We would love to have you join us. Okay. Ashlyn, would you like to speak about our medical assistant work?
Yes, thank you, Haley. Good afternoon. Ashlyn James, and I'm the champion for the medical assisting work group, director for medical assisting and phlebotomy at Cabrillo College. And last year we completed our hiring best practices guide. So that was really wonderful. And we're actually still kind of working with that. So the next piece was getting feedback from our graduates. We sent a survey out to many graduates from all different programs to get feedback about hiring straight out of the program and their success with that. And so we're getting some feedback that there are still a lot of barriers for students when it comes to finishing a program and then becoming a person that our healthcare partners want to hire. And so there's things like they've applied to 20 plus jobs or 10 plus jobs and have not been successful, or they're hearing that they can't find any open positions. They don't have enough experience. And so we want to continue to explore that. And our next meeting, that is something we're going to dive into, and creating a survey to send to our healthcare partners and to get feedback. So same type of thing that Adrian was saying, our industry partners drive this program. And so we definitely need the feedback on what is working, what's not working, and why, and how we can further meet your needs with our students to funnel them straight from the classroom into being hired. Looking at more streamlining as well is a huge thing. So I have talked to some of our industry partners on getting on a schedule of rotation and hiring and coming together with our documents and our packets and making things easier on everyone's ends. So that is really what we're focusing on now. We see that medical assistance is going to continue to grow. Opportunities for careers and hiring. And so we kind of just need to figure out how we can really get in there and make sure that it's happening in a timely manner, And again, having that streamlined process. And the other thing that's coming back is it's taking too long for people to get hired. And then there's a possibility of them just kind of taking whatever they can get because cost of living and, coming out of a program, a lot of them cannot work full time. So that is our main focus. Our next meeting is April 10th, and we meet second Wednesday of the month from 10 to 11 a.m. Anything else, Haley?
No, that was great. Thank you.
Thank you.
We send out the student survey to Cabrillo College, Santa Cruz COE, and the Adult Ed Medical Assisting Program graduates. And we got a 23% response rate, which I think is actually pretty phenomenal. So we were able to take, as Ashlyn said, all of those students' feedback to really look at what the barriers are to employment. And so we'll be continuing our efforts in that. So join us if you can. Again, Maria dropped her email in the chat and we can send you all the calendar invites. So these are all virtual meetings and they're only 1 hour. So please join us if you can. Our Santa Cruz County Nursing Council. So I saw through email threads that Cabrillo College was also awarded the California Apprenticeship Initiative Planning Grant for registered nurses. So this is the first part of that grant. The grant that Adrian was just talking about was the second part, the implementation. So this grant gives Cabrillo the opportunity to start looking into creating a registered apprenticeship for nurses. And I don't know, Jen, are you on? Jen, do you want to say anything about that?
About the nurse apprenticeship?
Yes.
Yeah, so we're excited about it. It's a planning grant, so we still have a lot of planning to do. But we're excited about the opportunity, and we are definitely looking at, we'll be getting more into really diving into that planning after spring break. We didn't want to dive too much into that before then and lose our momentum, but we are getting all our ducks in a row for getting that going.
Absolutely. Congratulations on being awarded. That's exciting news. And then we're also working on putting together another proclamation for National Nurse Week, which will be National Nurse Week is in May. So a proclamation that we can share with our Board of Supervisors. And I think, Anna, are you still on the call? Do you want to? Oh, she had to drop off. So Anna Sutton with Santa Cruz County HSA is leading that effort. And so we'll be discussing that more in our April meeting. And then the kind of update I know a lot of people have heard about was the 1440 Multiversity Healing Our Healthcare Heroes Retreat. We were able to send about 50 nurses to that retreat last year in August of 2023, and it was funded through a grant. So nurses were able to attend for free. It was a three-day retreat. And we're working on a proposal to try to fund that again. So I'm really excited about this. This is kind of, again, something happening behind the scenes. I'm working directly with my contacts at 1440 and Kaiser to put together a proposal to get funding to do this again for our county. So more on that coming. And the last thing I'll share about our Santa Cruz County Nursing Council is so you just heard from all of our wonderful facilitators. We've got Adrian and Ashlyn and Dr. Gordon helping facilitate the work of these groups because they're really the experts in these work groups. And what we need right now is we actually need somebody to volunteer to join our Santa Cruz County Nursing Council as a facilitator. So if you know anyone who would be interested in this work or wants to join us, again, the commitment's only once a month for an hour online. But we're really seeking a nurse in Santa Cruz County who could help us just by guiding the work that we're doing and bringing in their expertise and helping facilitate the conversations that we have. So if you have anyone in mind or you want to connect me with anybody, please do, and I'll make sure you all have my email one more time. So with that, we'll go to the next slide, and we're wrapping up. We only have a few more slides. So Maria.
Thank you, Haley. Yeah, we're wrapping up, but I did want to let everyone know that I recently updated our community health workers and promotores career pathway flyers in English and in Spanish to relate them back to the needs and suggestions that the Monterey Bay Community Health Worker Collaborative recommended we added to the new flyers. So a few of these changes include employers who hire CHWs or promotores, the average salary in the Santa Cruz region, and an active list of employment opportunities in Santa Cruz from Indeed. And as you can see on your screen, it's all laid out right there. And I also did want to plug that we are creating a flyer for home health aid to promote a new course at the Watson Row Aptos Santa Cruz Adult Education.
Great, thank you. Maria does a wonderful job updating our website and making all these beautiful resources. So please do check our website. I've dropped the link in the chat, but we'll share it one more time too, just so you can access all of the work that we've been doing. So very quickly, I'm just going to cover kind of what our next steps are looking forward. So we're currently working on getting organized to conduct our second listening tour. This is part of our grant deliverable with our High Road Training Partnership grant. We're going to be interviewing about 15 different partners across Santa Cruz County. And really the goal of this listening tour is to assess the effectiveness of our council and a needs analysis on the continuation of the council, and then developing either a sustainability or discontinuation plan. And we'll be putting all of those results together next year, but we'll start the tour this year in April and June of this year. We also, one of our grant deliverables is to host a community forum. So we'll be doing that in September of this year, and then at some point next year. And as I mentioned, our findings report will come out next year. And then at the end of 2025 is when we'll have our implementation plan for our next steps for the council. So that's like very big picture of what's happening over the next kind of 2 years here. So with that, like the exciting news for us to share is our community forum. Do you want to go to the next slide, Maria?
Yes. So speaking of the forum, we want to formally invite everyone to our community forum that's set to be on Thursday, September 12th at the Seascape Golf Club from 10 to 12 p.m. So refreshments will be provided, and along with the forum, we will be celebrating HIP's 20th anniversary, which is really exciting. And the pictures you see on your screen are from our last forum, which took place in person in 2022.
Yeah, I don't know if any of you were able to join us in 2022 in person, but it was just a wonderful time, especially after being virtual for so long, to connect in person. And so we're excited to be doing that again. I just dropped just the info in the chat, so save the date and hope you can join us. And we just have a few more things to share. Next slide, Maria.
Okay, so we are excited to invite you to an upcoming continuing medical education learning session. It's called Achieving Health Equity, Investing and Diversifying the Healthcare Workforce. It's taking place on Wednesday, May 1st from 8:15 to 10:15 in the morning, PST, via Zoom. This event is brought to you by the Dominican Family Practice Residency Program in partnership with the More in Common Alliance, Morehouse School of Medicine, and the Health Improvement Partnership of Santa Cruz County. And I'll share the registration link in the chat.
I just shared it too. So
awesome,
yeah,
thank you.
I got you.
Last announcement, our next Health Workforce Council quarterly meeting will take place in person on Wednesday, June 12th from 1:30 to 3:30 p.m. at the Santa Cruz County Community Foundation. We will have presentations from Santa Cruz Community Health around building a culture of belonging, and Janice of Santa Cruz around best practices for workforce onboarding. We will have time to network, and refreshments will be provided by Janice. I did send out an updated calendar invite yesterday. If you did not receive that invite or would like to invite someone to join, please feel free to email me so that way I can send it over to you. I also want to plug a reminder that all of our Health Workforce Council quarterly virtual meetings are recorded and they're available at on our webpage.
So as we started the work group updates, actually just go back one slide, Maria. As we started the updates, I mentioned that at the CPCA Workforce Symposium, we were able to connect with Santa Cruz County Community Health and Janice of Santa Cruz in person. And just through networking and conversation, like basically our topic came up for the next quarterly Health Workforce Council meeting. I don't know about you all, but I have a lot of Zoom fatigue. So I'm really excited for us to be hosting this in person Santa Cruz Community Health, they also presented a session at the Workforce Symposium, Building a Culture of Belonging. So we're bringing that presentation to you all free of charge, right? Because everyone who went to the symposium had to pay whatever $900 registration fee it was. So we're excited that they're going to be sharing this with us all free of charge. And Nicole, do you want to say anything? I know you're on this call. If you want to share anything about the Building a Culture of Belonging presentation.
Well, I was at that CPCA Workforce Symposium, and I can say our JEDI chairs who presented justice, equity, diversity, and inclusion were the envy. Everybody envied me because I have this team of really awesome pioneers in this field. So it is a fun presentation, a lovely group, and I highly recommend it if you can make it. Yeah.
We're so excited. So please do check that you got a calendar invite and respond yes or no. That will help us gauge our capacity for the event. And we're really excited about this. This will be our first ever in-person Health Workforce Council meeting. So very excited. Last slide is just to say thank you for your time. We are ending 8 minutes early, so that's great. Our contact information, which most of you should have by now. And as Maria mentioned, all of our resources and this recording will be posted to our webpage. So thank you everybody for your time and joining us. Take care, and we look forward to seeing you in our work groups and at our next meetings in person. Thank you, everybody. Take care.